Now we have a question from Ann from Lake Elmo. Please give us in detail how you will reform health care. You say you don't like what the president has done, but you give no details as to what you would do. Please be specific and help us understand what you want. Ann, thank you for asking that question. Come and look at my website, bachmann.house.gov, and I do have a plan posted. It's a very simple plan, and it won't be costing the taxpayers the literally trillions of dollars that Obamacare will be costing, because again, the president's health care plan is essentially socialized medicine. It is redistribution of wealth through health care, and the bottom line is it will be denial of care for millions of Americans, and we will see a skyrocketing of costs on health care. So we're going to end up paying a lot more and we're going to get a lot less. That's why I believe we have to fully repeal the president's health care plan. But this is what I would suggest immediately that we do. Number one, today there's a monopoly in every single state. It's a monopoly that the insurance companies enjoy, so that you and I in Minnesota can only purchase a health insurance policy that works in Minnesota. We can't go to Idaho, we can't go to Florida, we can't go to Michigan, we can't go to Tennessee to buy a health insurance policy. We can only buy one that complies with Minnesota law. I think that's wrong. I think what we should do is break down these artificial barriers and let every Minnesotan in the 6th District buy any health insurance policy they want, anywhere in the United States, with no minimum federal requirements. That's true freedom, and that way you can really shop for the cheapest possible policy and get a policy that meets your family needs. That's what I believe in, true cost control and competition, and do away with this monopoly that insurance companies have in every state. Here's the second thing we need to do, Ann. What we need to do is make sure that every American has the ability to take their own money, tax-free. Don't pay any taxes on your own income and apply that to whatever your health insurance costs are, whether it's your health insurance premiums, your copay, your deductible, maybe if you have to buy some medical devices or your pharmaceuticals, or maybe you need to go to a chiropractor, or maybe you need some alternative medicine that isn't normally covered today by health insurance. Every one of us have different health insurance needs. So I think whatever your needs are, if you have a lot of health insurance needs or if you have very little, you should be able to determine how much, not a government bureaucrat, people, not politicians, people, not bureaucrats. You best understand your health needs. You should get to take whatever amount of tax-free money you need and require for you and your loved one's health. That's what I believe. And then third, there are terrible cost plus-ups and increases because of medical malpractice insurance. If we could have true medical malpractice reform, that also would bring down the price of health care. And here's something else, associated health care plans. Let people band together in whatever groups they want to, much like a credit union, and go out and as a block buy cheaper health insurance. Why can't all realtors form together an associated health care plan? That could bring down the cost of health care, or increase what we call health savings accounts so that you can put aside that money and buy the health insurance that you need. There are so many great ideas. Go to my website. It's a very simple bill, about 18 pages long, and that's just the start of what we can do to bring down very expensive health care costs.